Hello and welcome to the last of the EBM sessions for 2020. This week we'll be looking at prognosis. Now, I'm Ross McDonald and that's the standard disclaimer. Today we'll be looking at three different things. We'll describe some aspects of prognosis, clinical questions and how you go about searching them. We'll look at using a tool in PubMed called Clinical Queries, and we'll have a look at some more reliable sources of patient information available on the internet. There is a clinical scenario associated with this week's work. There's a link to it there. You can go there and listen to that now, or you can listen to it later on. There is a practice exercise that you'll have to do, and you will need to watch that at some point. This is a summary of the clinical information from the clinical scenario that we've got today. And for the purposes of this demonstration, it's important to note that our patient is Mai. She's a 52-year-old female. She has been effectively diagnosed with chronic lymphocytic leukemia, or CLL. Karyotyping has shown that she has a single trisomy 12, so there's a single cell was noted to have trisomy 12. Now what our lady wants to know is, given this diagnosis, what's it going to mean for her? What's going to happen? That is a prognostic question. Now, being good medical students, you would rush off and you would answer your background questions, such as what is chronic lymphocytic leukemia, what is trisomy 12, what is a karyotyping test, and so on. And you can look in Access Medicine, Access Pharmacy, Clinical Key, you can look in medical dictionaries and so on to find those answers. You put together a PICO where you describe your patient or problem, the intervention, a comparison, and an outcome. Now, in fact, prognostic questions are the ones that least fit into a PICO framework. This is because often there is no comparison. There may not even be a clear intervention other than the presence of a disease, and the outcome may be very hard to define. So for this particular one, was said our patient is a middle-aged female with chronic lymphocytic leukemia. Now, the intervention is the odd thing that's about her that we happen to know can have an influence on the course of the disease, and that is the trisomy 12. There is no comparison. We don't really want to compare her to someone who doesn't have that because she simply does have it and there's nothing we can do about it. The outcome is that our patient has asked us how long we're going to live, so it's survival. Now that's a fairly blunt kind of an outcome. It may be much harder to put into words than that. People often ask questions about lifestyle if they have a long-term condition or one that's going to sort of last them for the rest of their lives. They may ask about, will I still be able to play tennis? Will I still be able to do this, that, and the other? So they're often lifestyle questions. They're often hard to put into words that will actually be searchable and capture the essence of their problems. But in this case, our patient is worried about how long she's going to live with this condition. Now, you've used PubMed plenty on this course. You've seen how to use keywords and filters, and you've used Mesh. The new search technique that we're going to show you this week is called PubMed Clinical Queries. Now, you get to PubMed Clinical Queries, go through the DLib homepage as always, and just go through the PubMed link down here. When you get to PubMed, if you're looking at the old PubMed, Clinical Queries is found just down here. And just click on that. That's it there. If you should happen to find yourself in the new PubMed interface, it's essentially the same thing. Go down below the search box and under Find, you'll find Clinical Queries there. When you click on it, you'll get exactly the same interface. It goes back to one that's sort of in the old style. Now, using Clinical Queries, you can put in a search just as you always would. In this case, I'm going to use a fairly simple search. I'm looking at chronic lymphocytic leukemia and trisomy 12 and survival. Now, I'm not going to try and describe our patient using limits or anything at the moment. I'm just going to do that. Note that chronic lymphocytic leukemia and trisomy 12 are both phrases that are recognised automatically by PubMed, so I don't need to try phrasing or anything like that. Hit search, and it gives me the results presented in three different ways here. The one we're going to be looking at is over on the left-hand side here, the clinical study categories, and I'll get to that in a moment. But do note that if you're looking for systematic reviews, it can also do that. In this case, there are none found. Or if you're looking for papers in particular on medical genetics, you'll find them over there on the right-hand side. Now, under the clinical study categories here, it has assumed that we're doing a therapy search because that's the most common kind. But in fact, we're interested in a prognosis study. So we can choose prognosis there. And when we do now, we've got 152 results. Now you can have broad and narrow searches. I would be inclined to leave it on broad unless you had a reason not to, unless, for instance, you are overwhelmed by vast numbers of results. Just to show you what the PubMed Clinical Queries is doing, if we go down here, what it's actually doing is applying a filter to your search. Now, this is slightly different from the limits that you've seen. Here's how the filters in clinical queries work. We'll have a look at the one on therapy here. Now, if you look at it, there are two versions, the sensitive and broad here. I just want you to look at the broad one. When you do, this is what it's actually searching for. It's not just looking for a clinical trial type, although it does add that in there. It also looks for the words clinical and trial in the title and abstract. It looks for clinical trials as a mesh term. It looks for therapeutic as a mesh subheading. It looks for the word random in the title and abstract. So it's kind of trying to focus in a little bit on RCTs and so on. Now, these filters can be thought of as being like diagnostic tests in the sense that they have a specificity and a sensitivity to them. So, for instance, the broad one has a high sensitivity. It finds 99% of all the relevant results, or at least it did in the study where they actually developed the filter. On the other hand, a fairly high proportion of those were not actually relevant, so that it wasn't very specific, or 70% specific. Compare that to the narrow search where it found 93% of the results. So it lost a few, but on the other hand, the proportion of true positives was greater. So here we are back at our result. You can go and now see all of these results by just clicking here where it says See All. And there you'll find a typical result page from PubMed. If you look up in the search bar, you'll see that your Prognosis/broad filter has been added in, and that is just a search term that automatically triggers the use of that filter, followed by and then it's got the terms that you put in. At this stage, you can add other terms if you want to. You can put in mesh terms if you want to. It doesn't matter. You can also add limits. So we haven't addressed our patient in this search yet, so I'm going to go over here, add some additional filters for sex and age. We have a female. So I apply that filter, and she is adult, and I could narrow that down to middle age if I want to, and it will come down to 83 results. And you'll see that many of them have trisomy 12 or some variation on chronic lymphocytic leukemia in the title. Also, we'd like to give you a quick note about patient information. We've told you before about using Access Medicine or Clinical Key or Micromedics. There's also plenty of information available on the open web, but we would stress that you need to exercise due caution when using it. Does the information on a particular website reflect your professional understanding of the disease or the treatment or whatever it is you're looking up and want to tell your patient about? Is the information up to date? Who's producing it and why are they producing it? A surprising number of medical information sites are in fact pushing some kind of agenda. It may be to sell something, and maybe there is a political agenda. It's surprising how common this is. So understand who is producing it and why. If you may remember the CRAP test from way back when we were teaching you in pre-med, this is a useful tool to fall back on for analysing this sort of thing. A couple of websites that are very useful, the Mayo Clinic, which has a section on diseases and conditions, and Medline Plus. Now here's the Mayo Clinic site, produced by the Mayo Clinic, which is a very well-respected medical establishment. It's very trustworthy information. It's organised in this case by diseases and conditions with information aimed at patients. There's this here, so you can go through here, look at conditions, you look at symptoms, advice on healthy lifestyles, and so on. Another tool is Medline Plus. Now, this is produced by the National Library of Medicine, and once again, it's a vast repository of patient-oriented medical information, and we strongly suggest you get used to using this to look up things that you can give to your patients. Finally, just a quick note, remember that this is a prognosis question, so this quality of evidence you get is slightly different from, for instance, a therapy question. Often the best kind of study you'll find is a cohort study, where people simply have a condition and they are followed throughout the course of their lives to see what happens. So thank you very much and good luck with the case.